The photograph is small, no larger than a man's palm. Its edges are worn, softened by time, or by hands that held it too often. It was taken in 1891, a surgical ward, gaslight barely reaching the corners of the room, iron bed frame, white sheets, already discolored. At first glance, it appears ordinary. A man lies on the bed, his head slightly elevated, his hands folded with care. But the longer you look, the more unsettling it becomes. Because Edmund Crowe is smiling. Not weakly, not nervously, but calmly. His eyes are open, focused, alert. This alone would not be unusual. What disturbs the viewer is the object resting beside him. A small chalkboard. On it, written in careful handwriting, time of death, 11:42. The photograph's timestamp reads 9:17. No correction was ever found, no explanation attached, and the board was not added later. The glass plate negative confirms it. The message was there when the shutter opened. This image would be sealed for decades, but before that happened, it raised a question no one present could answer. How did a living patient know the precise minute of his own death?
The year 1891 existed at a fragile crossroads. Medicine was advancing, but not fast enough. Anesthesia had only recently become reliable. Antiseptics were still debated. Infection was common. Death was expected. Hospitals smelled of carbolic acid, of sweat, of fear. Doctors wore authority like armor. Patients surrendered control completely. Photography had become a tool of documentation, not art, not memory, but proof. Glass plates captured reality without mercy. Every wrinkle, every tremor. Victorian society believed deeply in order, in progress, in rational explanation. And yet, they were haunted by uncertainties. Electrical experiments hinted at unseen forces. Neurology struggled to explain consciousness. Time itself was still considered absolute. There were no theories of temporal distortion, no language for paradox. If something did not fit, it was dismissed or buried. Edmund Crowe entered this world not as a mystic, not as a visionary, but as a patient. Edmund Crowe was ordinary, 36 years old, a clerk for a railway accounting office in York, married, no children. His medical records show nothing remarkable. No mental illness, no seizures, no delusions. Colleagues described him as precise, methodical, almost painfully punctual. He kept meticulous notebooks, schedules, margins aligned perfectly. What made him special was subtle. Edmund had an unusual relationship with time. He carried a pocket watch even indoors, checked it obsessively, corrected others when they misstated the hour. Friends found this amusing. Doctors did not. In early April of 1891, Edmund began experiencing abdominal pain. Severe, persistent. Diagnosis: intestinal obstruction. Surgery was recommended. Risky, but necessary. Edmund accepted calmly. Too calmly.
The first report comes from Dr. Lionel Harrington, attending physician.
3 days before the operation, Harrington noted something strange. Edmund asked a question, not if he would survive, but how long consciousness persists after clinical death. The question was dismissed. Curiosity, anxiety. The next day, Edmund corrected a nurse. She told him surgery was scheduled for late morning. He replied, "No, it will end at 11:42. She laughed. He did not. That evening, Edmund requested pen and paper. He wrote several pages, sealed them, labeled them, post-operative observations. This was logged, meticulously documented.
During preparation, Edmund's pulse remained steady.
Too steady. 80 beats per minute, unchanging, even as fear should have increased it.
Dr. Harrington ordered repeated measurements, identical results.
Edmund spoke quietly. He described the operating room, not the present one, but another. He mentioned the position of instruments, the exact words spoken by the surgeon, words that had not yet been said. At 11:30, Edmund whispered, "There will be confusion," briefly. Witnesses later swore this under oath. At 11:41, Edmund inhaled sharply and said, "Now." At 11:42, Edmund Crowe's heart stopped. No warning, no surgical error. Immediate resuscitation failed. Time of death was recorded. Later examination revealed something impossible. Edmund's brain showed signs of hypoxia before cardiac arrest, as if the sequence had reversed, as if death had preceded itself. The photograph was taken moments before surgery. The chalkboard was Edmund's request. No one questioned it until it was too late. Dr. Harrington resigned 6 months later. He burned his private notes. The hospital wing was renovated, then closed, then demolished. Edmund's sealed writings were never opened. They were archived, restricted, stamped, temporal anomaly, unresolved. The file disappeared during the Second World War, or so the official record claims. A speculative paper published in 2014 proposed a theory that consciousness may briefly access future neurological states, that identity is not linear, that time within the brain is not absolute, but fragmented, unsettling, inexplicable. If Edmund Crowe experienced his death before it happened, what does that say about now? About memory? About choice? About you? Subscribe and remember, some moments arrive before you are meant to live them.